Carbohydrate is not bad. Carbohydrate is not evil. I've observed that a lot of people on social media advise diabetes patients not to take carbohydrate at all. But that is totally wrong and misguided. Carbohydrate is not bad. But the question here is, which kind of carbohydrate is good and which kind of carbohydrate is bad? You know that we have different types of carbohydrate. We have simple carbohydrates, we have complex carbohydrates, we have refined sugars, we have complex sugars, or we have unrefined sugars. So you need to understand which one you're talking about before you condemn carbohydrates. There are benefits that you can derive from eating carbohydrates. So when you talk about simple sugars or refined carbohydrate, they are the ones that we do not want diabetes patients to take, like the sugar, like meat pie, like cake, like bread, like all other simple sugars that you can think of, like juice. All these ones, they are likely to elevate your blood sugar and they put you at risk of a lot of problems. They increase the risk of obesity. They increase the risk of developing type 2 diabetes if you are not diabetic. But if you are diabetic already, it puts you at risk of heart problems like heart attack. It also puts you at risk of different kind of health issues. It also puts you at risk of cancers and other problems. So when you talk about simple sugars or refined sugars, diabetes patients are not advised to use them. But come to think of complex carbohydrates. These are carbohydrates that you find in your grain, in your potato, grains like wheat, like millet, like maize and other things. If you do not overprocess them, you can use them because they have fiber, they have sugar, they have minerals and vitamins. And that fiber ensures that when you take them, it does not elevate your blood sugar. And the fiber is very good for your intestine, for your gut health, so that you will not have issues. Most people that take refined sugars, they are the ones that develop pile and other problems. But when you take complex carbohydrate, you will not have intestinal issues. Okay, then apart from that, the minerals, the vitamins are very important for your heart, for your brain, for your nerves and other things. So you cannot tell diabetes patients to totally put aside carbohydrate, even the good carbohydrate, and forgo all the benefits that they can get from it. It is important for us to differentiate. Are you talking about simple carbohydrates or complex carbohydrates? For diabetes patients, please feel free and take complex carbohydrate, but always ensure that you observe portion control.